U-G-L-Y. HMOs, you cheating lie, you ugly. You ugly. Greed. G-R-E-E-D. Your premium rates. Don't fool me, you greedy. You greedy.
Dave Feinwachs. I've been involved in this issue for some time. HMO transparency and accountability and use of public funds has been a passion for me for well over a year. Okay, here's what's wrong about the system. You know this new one-stop website we've got for HMO transparency? If you look at that website, what you're going to see is between 2003 and 2007, the HMOs made 5 times more money managing the Medicaid program than they did selling commercial insurance. That's not possible. Okay? That tells you how out of whack this system is. You cannot be 5 times more profitable if you're actually providing health care to lower socioeconomic sick people who have problems, who are out of work, who have health issues. That can't possibly be 5 times more profitable unless there's something else going on. And that something else going on is excess reserving. The solution is to demand transparency and accountability, to get a hold of these books. We're all taxpayers. We have a right to know where every penny of this money goes, and when we see where it goes and we don't like where it's going, you change the system. Well, you've got to get to legislators and convince them to have hearings on these issues, because the HMOs are convincing people that without them, this system collapses, when in fact, if they are allowed to run this system any longer, they will cause the collapse of this system. Eventually, so many people will be without health care coverage that the system will collapse. I was the general counsel for the Minnesota Hospital Association.
Did they tell you when you were being laid off that it had to do with this?
Yes.
Or did they make up a bogus?
Well, actually, I'm in the middle of litigation on that issue, so I can't really talk about it.
And we're here to say that the HMOs, the managed care organizations, have been hoarding their profits for far too long. Right now they've accumulated $2.5 billion with a B, in their reserve funds that they're putting in their bank accounts. They're investing it in the stock market. This has got to stop.
Healthcare for people, not for profits.
It's the HMO short!
The managed care experiment has had its chance for 15 years.
Too many years.
And the managed care experiment has failed. It's time for publicly funded health care. And we can do this. It's not just that they're extremely inefficient in their operations, but it actually is causing a major deterioration in patient care. So this isn't just about the money, this is about the quality of patient care for the people of Minnesota. They have no business being in these programs in the first place. None of the public never allowed for this to happen. This completely happened behind the scenes. The regulators are not regulating the HMOs, and we need accountability. We've got to get HMOs off corporate welfare.
I'm Elizabeth Frost. I'm a family practice doctor in town, and I am here today for my patients. I am here today because I'm standing against the corporate profiteering that's going on, even in Minnesota, even though these are supposedly non-profit. And the thing that's really freaky is that we don't even have any idea what's going on, because they won't open up our books to audits. It is every other, this is public money that we're giving these programs, public money, and they're non-profit health plans, and we're not allowed to look at their books and figure out what's going on with their money. So my question is, what are they hiding?
Stop cooking the books. Stop cooking the books. Stop cooking the books. Stop cooking the books. Stop cooking the books.
Eileen Weber, I'm Vice President of the Minnesota Nurses Association.
And Michelle Barrett, representing the Minnesota Podiatric Medical Association. Well, we're wondering why there aren't hearings at the legislature when there's such massive bipartisan support. Certain committee chairs have promised legislative hearings, and then they got pulled. We had people ready to testify before the legislature, the Civil Law Committee, 2 hours before doctors and pharmacists and podiatrists and other healthcare providers were to testify. The bill gets suddenly pulled. Dozens and dozens of legislators, and they want this heard. They want to address this issue. They want to know why the health plans have $2.5 billion in reserves.
Because there are dozens of lobbyists at the Capitol who are talking them out of it, and that's another immoral use of the money that should be going for health care. Is this persuade committee chairs not to hear bills that have a huge interest to the public.
Republican legislators are currently trying to push through this constitutional amendment. Meanwhile, they're letting the HMOs squander $3 billion of public dollars. This seems to be a misapplied priorities by the people at the legislature. And these were the Republicans are supposed to be the fiscal conservative ones who are watching out for the public dollars.
You guys want to take a picture of our family? Somebody help us!
No.